NMC CBT questions and answers. Question number 651. A client has a diabetic stasis ulcer on the lower leg. The nurse uses a hydrocolloid dressing to cover it. The procedure for application includes Option A. Cleaning the skin and wound with betadine. Option B. Removing all traces of residues for the old dressing. Option C. Choosing a dressing no more than 1/4 inch larger than the wound size. Option D. Holding it in place for a minute to allow it to adhere. The correct answer is option C. Choosing a dressing no more than 1/4 inch larger than the wound size. Question number 652. You have just finished dressing a leg ulcer. You observe patient is depressed and withdrawn. You ask the patient whether everything is okay. She says yes. What is your next action? Option A. Say, I observe you don't seem as usual. Are you sure you are okay? Option B. Say, cheer up. Shall I make a cup of tea for you? Option C. Accept her answer and leave attend to other patients. Option D. Inform the doctor about the change of the behavior. The correct answer is option A. Say, I observe you don't seem as usual. Are you sure you are okay? Question number 653. Sharp debridement may cause trauma to underlying structures. The procedure should only be carried out by Option A healthcare assistant on working full-time. Option B. A qualified nurse with at least 3 years experience. Option C. A doctor of any type of speciality. Option D. A qualified healthcare professional with appropriate training. The correct answer is option D. A qualified healthcare professional with appropriate training. Question number 654. How much urine should someone void an hour? Option A. 0.5 to 1 ml/kg/h of the patient's body weight. Option B. 2 ml/kg/h of the patient's body weight. Option C. 40 mls. Option D. 50 mls. The correct answer is option A. 0.5 to 1 ml/kg/h of the patient's body weight. Question number 655. What is the most important guiding principle when choosing the correct size of catheter? Option A. The biggest size tolerable. Option B. The smallest size necessary. Option C. The potential length of use of the catheter. Option D. The build of the patient. The correct answer is option B. The smallest size necessary. Question number 656. Common signs and symptoms of a hypoglycemia exclude. Option A. Feeling hungry. Option B. Sweating. Option C. Anxiety or irritability. Option D. Blurred vision. Option E. Ketoacidosis. The correct answer is option E. Ketoacidosis. Question number 657. Common causes for hyperglycemia include. Select 4. Option A. Not eating enough protein. Option B. Eating too much carbohydrate. Option C. Overtreating a hypoglycemia. Option D. Stress. Option E. Infection, for example, colds, bronchitis, flu, vomiting, diarrhea, urinary infections, and skin infections. The correct answer is option B. Eating too much carbohydrate. Option C. Overtreating a hypoglycemia. Option D. Stress. And option E. Infection, for example, colds, bronchitis, flu, vomiting, diarrhea, urinary infections, and skin infections. Question number 658. Most of the symptoms are common in both type 1 and type 2 diabetes. Which of the following symptom is more common in type 1 than type 2? Option A. Thirst. Option B. Weight loss. Option C. Polyuria. Option D. Ketones. The correct answer is option D. Ketones. Question number 659. You are preparing to consider a tuberculin, Mantoux, skin test to a client suspected of having TB. The nurse knows that the test will reveal which of the following. Option A, how long the client has been infected with TB. Option B, active TB infection. Option C, latent TB infection. Option D, whether the client has been infected with TB bacteria. The correct answer is option D, whether the client has been infected with TB bacteria. Question number 660. How do you ensure the correct blood-to-culture ratio when obtaining a blood culture specimen from an adult patient? Option A, collect at least 10 milliliters of blood. Option B, collect at least 5 milliliters of blood. Option C, collect blood until the specimen bottle stops filling. Option D, collect as much blood as the vein will give you. The correct answer is option A, collect at least 10 milliliters of blood. Question number 661. Which of the following techniques is advisable when obtaining a urine specimen in order to minimize the contamination of a specimen? Option A, clean around the urethral meatus prior to sample collection and get a midstream clean catch urine specimen. Option B, clean around the urethral meatus prior to sample collection and collect the first portion of urine, as this is where the most bacteria will be. Option C, do not clean the urethral meatus as we want these bacteria to analyze as well. Option D, dip the urinalysis strip into the urine in a bedpan mixed with stool. The correct answer is option A, clean around the urethral meatus prior to sample collection and get a midstream clean catch urine specimen. Question number 622. A normal sign of aging in the renal system is option A, intermittent incontinence. Option B, concentrated urine. Option C, microscopic hematuria. Option D, a decreased glomerular filtration rate. The correct answer is option D, a decreased glomerular filtration rate. Question number 663. How should be the surrounding area of a patient with dementia? Option A, increased stimuli. Option B, creative environment. Option C, restrict activities. The correct answer is option B, creative environment. Question number 664. An 86-year-old male with senile dementia has been physically abused and neglected for the past 2 years by his living caregiver. He has since moved and is living with his son and daughter-in-law. Which response by the client's son would cause the nurse great concern? Option A, how can we obtain reliable help to assist us in taking care of Dad? We can't do it alone. Option B, Dad used to beat us kids all the time. I wonder if he remembered that when it happened to him. Option C, I'm not sure how to deal with Dad's constant repetition of words. Option D, I plan to ask my sister and brother to help my wife and me with Dad on the weekends. The correct answer is option B, Dad used to beat us kids all the time. I wonder if he remembered that when it happened to him. Question number 665. Which of the following is a behavioral risk factor when assessing the potential risks of falling in an older person? Option A, poor nutrition fluid intake. Option B, poor heating. Option C, foot problems. Option D, fear of falling. The correct answer is option A, poor nutrition fluid intake. Question number 666. When treating patients with Clostridium difficile, how should you clean your hands? Option A, use alcohol hand rubs. Option B, use soap and water. Option C, use hand wipes. Option D, all of the above. The correct answer is option B, use soap and water. Question number 667. Among the following drugs, which does not cause falls in an elderly? Option A, diuretics. Option B, NSAIDs. Option C, beta blockers. Option D, hypnotics. The correct answer is option B, NSAIDs. Question number 668. Mr. Bond, 72 years old, complains of difficulty of chewing his food. He normally wears upper dentures daily. On assessment, you noticed some signs of gingivitis. Which of the following signs will you expect? Option A. Redness of soft palate and tissues surrounding the teeth. Option D. Hemoserous discharges around the gums. Option C. Loosening of teeth. Option D. Presence of pockets deep in the gums. The correct answer is option C. Loosening of teeth. Question number 669. Which of the following is a sign of dehydration in the elderly? Option A. Diminished skin turgor. Option B. Hypertension. Option C. Anxiety attacks. The correct answer is option A. Diminished skin turgor. Question number 670. Barbara, an elderly patient with dementia, wishes to go out of the hospital. What will be your appropriate action? Option A. Call the police. Make sure she does not leave. Option B. Encourage the patient to stay for his well-being. Option C. Inform the police to arrest the patient. Option D. Allow her to leave. She is stable and not at risk of anything. The correct answer is option B. Encourage the patient to stay for his well-being. Question number 671. Conditions producing orthostatic hypotension in the elderly. Option A. Aortic stenosis. Option B. Arrhythmias. Option C. Diabetes. Option D. Pernicious anemia. Option E. Advanced heart failure. Option F. All of the above. The correct answer is option F. All of the above. Question number 672. Angel, 52 years old, lose her husband due to some disease 4 weeks later. She calls her mother and says that, "Yesterday my husband died. I didn't know that he was sick. I can't sleep and I see rats and mites in the kitchen." What is Angel's condition? Option A. She can't adjust without her husband. Option B. Late grievance with signs of dementia. Option C. Alzheimer's with delirium. The correct answer is option B. Late grievance with signs of dementia. Question number 673. Why are elderly prone to postural hypertension? Select which does not apply. Option A. The Barrel-Flex mechanisms which control heart rate and vascular resistance decline with age. Option B. Because of medications and conditions that cause hypovolemia. Option C. Because of less exercise or activities. Option D. Because of a number of underlying problems with BP control. The correct answer is option D. Because of a number of underlying problems with BP control. Question number 674. Recommended preoperative fasting times are option A. 2 to 4 hours. Option B. 6 to 12 hours. Option C. 12 to 14 hours. The correct answer is option B. 6 to 12 hours. Question number 675. A patient is being prepared for a surgery and was placed on NPO. What is the purpose of NPO? Option A. Prevention of aspiration pneumonia. Option B. To facilitate induction of pre-op meds. Option C. For abdominal procedures. Option D. To decrease production of fluids. The correct answer is option A. Prevention of aspiration pneumonia.